Hi, I'm Jackie Goodrich. I'm a faculty member here in environmental health sciences at the Michigan School of Public Health. I actually did my graduate degree here as well in our program in toxicology. I did my PhD here, so I know a lot about our program and our excellent research and culture, and I'm really excited to tell you all about it today. And I'm excited that you're interested in applying to our program or one of our programs. So today will be, we're kind of give you a broad overview, a broad snapshot of who we are at EHS. What are some of the careers that people who get our degrees go into? We'll give some info on each of our different degrees, not the full details, but some details to get you started thinking about which one might be best for you. We'll have lots of time interspersed for questions and answers, and we'll also have some breakout rooms where we'll talk about specific areas of research and public health practice that our faculty and our students work in. This isn't everything we do, but it'll give you an idea of what just some of the cool things are that happen in this field. And then at the very end, for the last bit of time, you can go into a separate breakout room with some of our current students and ask them, whatever you would like about what it's really like here if you're a student here. So with that in mind, I took the registration list for our session today and put in, what people's majors were from their current or their last degree. And you can see, people come to environmental health sciences from all kinds of backgrounds. There's some things you expect, like public health, biology, biochemistry, but it's not necessary to come from that type of background and be successful in environmental health. A lot of times we have people in our field that come from more of an international studies side, a global health side, from an environmental policy side, even from the medical sciences. And really what unites us is that we want to use our various backgrounds to pursue ways to prevent disease, to uncover the environmental drivers of disease so that we can prevent them and make, everybody healthier before they even need to see a doctor. And so for just a little icebreaker to get us started and to give you a chance to participate right off the bat, why don't you tell us in the chat, you can just type in the chat box there, answer to one or both of these questions. What does environmental health sciences mean to you? And also, what are you passionate about, especially in thinking about your career that you'd like to have? And I know while people are typing and thinking about that, I can say, for me, environmental health sciences really means marrying the things that I care about the most, kind of both the biomedical sciences, but also environmental issues, and using and figuring out what some of the most pressing environmental issues are so that we can target them for prevention and prevent, diseases instead of having to treat them. So that's what EHS means to me. And I think I have been passionate about it since I learned what it was when I was an undergraduate student, because I really care about, the planet and environmental issues, but also people. And I think, being in this field allows me to try to improve the world and the health, for both the environment, ecology, and people too. So yeah, I love these responses so far. This is great. I think we're all going to get along together very well. Everyone who's here today. Well, I'm going to keep rolling just so we can have time for lots of, discussion as well. But feel free to keep putting both your passions in the box and reading what, your fellow students have to say. And also throughout this session, feel free to put questions in there too, and we'll make sure to either answer them right in the chat or get to them later in the session. So we'll get into more about, how you study environmental health sciences at the University of Michigan. But, I'd like to make a plug first off the bat for why you might want to come here to do that instead of going somewhere else or studying in some other field. And I think, being in this department so long, I know that our faculty are very collaborative and accessible. We're really passionate about what we do. And we have, what I think of as a small, close-knit community that is there for one another and likes to work on projects together to improve this field. And we also have a lot of resources here. Our university is actually really large and has a lot of research funding and a lot of internal funding that you can apply for if you want to travel somewhere for research or for a job or go to a conference. We just have a lot of resources that students specifically can apply to and get quite easily to advance your career in various ways. We're always improving our teaching and trying, new innovative things, new strategies. And we even have an office here at the school that helps with that. And we're really just an interdisciplinary place that bridges lots and lots of expertise to tackle, pressing issues in an innovative way. And this isn't all encompassing, but this is kind of a cycle that shows a lot of different things that happen in the field of EHS. So environmental health sciences is really focused on understanding what causes diseases so that we can then prevent that. So if you start at the bottom, some of the things we do are identify the drivers. What are the environmental hazards? Where are they coming from? For instance, we have some faculty who've worked with electronic waste and how, chemicals from that leach into environments and get into workers and communities that are near those waste sites and cause health problems. So finding the drivers, where are the toxic exposures, where are the hazards coming from? Then, a lot of people in our field work on monitoring and preventing the environmental impacts. So figuring out, measuring these things in the environment, where are they getting to, what are the levels? And then, a big part of our field works on worker health. Workers can be especially exposed, to high levels of things or constantly to certain chemicals in the workplace. So mitigating health effects for workers, and then also on the, non-worker side of things, looking at chemicals that get into products, consumer products, and figuring out how to replace them with healthier things or mitigate those exposures to keep people healthier. And then, of course, a big portion of our field also looks at more biologically, what are the mechanisms? How are these exposures leading to some health outcome, and how could we prevent or treat that? And within our department, we have people that specialize in each of those areas in that kind of cycle that I just showed. And we also have, this is just a snapshot of just some of the things that we do. We have a little over 40 faculty members, over 60 students in our various degrees. And we have a really good student to faculty ratio, which means you can access us quite easily. And then we have a lot of these research centers and training grants that provide funding to advance our educational or research missions in this field. And we do lots of cool research, which you'll hear about in the breakout later. And we're really a school. The 40 student organizations at the bottom is referring to just in our School of Public Health. We have 40 student organizations, that do service or social outreach. They all have different focuses, professional societies, and our student body here is just really engaged and really collaborative. And if you have, a passion or an interest, you can basically find a group of students who have that same passion as you when you're here. And with that, I'd like to pass it along to another one of our faculty members, Dr. Penny Pereira.
Thanks, Dr. Goodrich. That's me. I'm research faculty in the department, and I was also a postdoctoral fellow for about 4 to 5 years before I became faculty in the department. So I'm quite familiar with how the students feel and how research kind of works in the department. So why EHS? Where are previous graduates from our department, and how are they doing? A lot of our graduates are working in a very diverse fields, including industry, academia, government, law, you name it. It's a very diverse group of people, and when they graduate, their interests are very different, and they kind of go where their passions lead to. On average, based on the 2020 survey of EHS graduates, the entry-level median salary is around $63,000 for our graduates. But we presume that this number has increased from 2021 to 2022, which accounts for inflation and also the higher number of graduates that are coming out. So down over here, you can also see that about 93% of our 2020 graduates are employed or pursuing an additional higher degree. And we also suspect that this number has increased since 2020. Next slide, please. U of M is a beautiful campus. It's located in a beautiful town called Ann Arbor. It's named #1 best college in town in America, college town, and also the most educated city. And it's #2 best place to live. And as you know, you may well know that it's one of the best Big Ten colleges for football as well as other sports. And it's one of the most beautiful college campuses in America. And it's coming from a tropical island and warm weather in Louisiana. Winter was a bit difficult to grasp, but the beauty of Michigan and in Ann Arbor is that you get to experience all 4 seasons. Right now, when we look out the window, all the leaves have beautiful colors, nice fall weather outside. So you will enjoy Ann Arbor, and just 10 minutes down from campus is downtown, and there's always things to do downtown. There are lots of restaurants, music, an art festival that happens every summer, and there are a lot of diverse groups of people here, and it's a very welcoming community. And if you are interested in some of the student groups are also involved in a lot of these parks, running, biking activities, and the EHSA, the EHS student organization, is very involved in a lot of community service activities as well around campus. And since I mentioned diversity and community, I'm also a part of the department DE&I community, the DE&I committee, which stands for Diversity, Equity, and Inclusion. And our mission is to increase the diversity of our community, be it students, faculty, staff, and make sure that our environment and our community is equitable, and then there's equal opportunities for everybody. And also to be very inclusive and be mindful, be respectful, and make sure that everybody is included in a lot of the events that we plan as well. Next slide. And we are a very collaborative community. EHS is maybe small, but we make a very big impact, be it research or throughout the community. We believe in compassion, innovation, inclusion, and impact. As we said, like, we care about the people, we care about the students, we care about you. So we want to make sure that not only knowledge from classes and research and teamwork, but also thinking about people in general and making sure that there's work-life balance for the students, and making sure that that you as a person is happy, healthy, and efficient when you go out to the workforce to help your community. We make sure that you are valued and that the people that you serve are valued as well. And with that, I will pass it on to Dr. Tim, I think.
Yes, thank you very much, Peony. Hi, folks. I'm Tim Devant. I'm also a faculty member here in the department. Notably, I serve as chair of our admissions committee. So I really look forward to reviewing all of your applications. And we will talk about admissions here in a moment. But first, a quick overview of some of our degree and program options. We do offer a couple of different types of master's degree. One is our Master of Public Health. Another is our Master of Science. We also offer doctoral degrees, so our PhD program. Our master's degrees generally take about 4 semesters to complete. That's a little less than 2 years' time, about 20 months total. Our MPH is a professional degree program. It does have a required internship component. Our Master of Science, in contrast to that, there is coursework required, but the focus is on research and completing a thesis project. And then the PhD is highly research focused. There are some required courses, but it's really designed to prepare students for a research-based career. So before we get into too much detail, one of the common questions is, what's the difference between an MS, Master of Science, and an MPH, or Master of Public Health? So like I mentioned, the MS degree is primarily research-based. Students conduct original research that's evaluated by a thesis committee. And the goal of this MS program is really to obtain new knowledge, learning how to be a scientist. During the summer, between your first year and second year in the program, you'll be conducting research, working on your thesis project, and there's not an internship component that's required as part of the MS. In contrast to that, our Masters of Public Health degrees, or our MPH degrees, they are primarily course-based. There's no required research component. So all of the evaluation takes place within the classroom, within courses. And the goal of this degree is understanding current knowledge so that you can go out and then apply it in a professional setting. And then in contrast to the MS, our MPH students do have a required internship that they generally complete during the summer between the first year and second year in the program. A little bit of a breakout of what your time here might look like. First, starting with our MPH degrees. We have a couple of different programs, one in environmental health sciences, one in environmental health promotion and policy. We also have some specializations that you can focus in on. But basically, regardless of which MPH program you come into, there are school level core requirements that all students must complete. And these are courses that we feel like every MPH student should have a solid understanding with after they graduate. Courses on biostatistics, epidemiology, things that are truly core to a public health degree. Beyond that school level core will be department specific courses that are required. So our EHS core, there you'll learn about exposure science, whether it's physical hazards, chemical hazards, or biological hazards. You'll learn about essentials of toxicology, so mechanistically what's happening following exposure within someone's body, occupational environmental diseases, and so forth. Beyond these core requirements, there are electives. You do have freedom to pursue your interests beyond your core. We'll talk about specializations in a few minutes, as well as opportunities for graduate certificate programs. And then again, just to reemphasize, for the MPH programs, there is a required internship component. So let's dig into those first few examples of some specializations where you can focus on. And for the first one, I'll introduce Professor Aurora Lay.
Hi, thank you. So hi, I'm Aurora Lay. I am one of the core faculty of the Industrial Hygiene program. And if you're like me, I actually didn't know what industrial hygiene was until like the first year of my master's degree. So you are already way ahead of schedule. People often think, what is industrial hygiene? Does it have to do with like cleaning teeth, or what is it all about? It's not about cleaning teeth or manufacturing things, but in another way of saying it, it is essentially occupational health science. So we are one of the premier programs in the United States. I'm not just saying that to toot our own horn, but they often think of Michigan as, you know, the cradle of industrial hygiene, where many alumni and presidents of the American Industrial Hygiene Association have graduated from as alumni, where the threshold limit values were created, and all that good stuff. And our MPH IH students generally have job placement rates anywhere between 95 to 100% per cohort, and starting salaries about 70,000 to upward of 6 figures. So if you want to get just your master's and make more than me, that's a definite possibility. But you know, IH is so varied. So, you know, we have different facets of occupational health. Wherever you go, there are workers who have to be protected. So we have emergency response, global occupational health, obviously chem exposures is a big one, research training, ergonomics. It's a super rewarding, high impact career. You can work at the government for the National Institute of Occupational Safety and Health, or you can work for private industry like Chevron or Boeing, or even 3M, which doesn't just make sticky notes. They also make respiratory protective equipment. So that is just a quick snippet about that. And in the future, if you're interested in learning more about IH, each of these programs will have program-specific interest nights, just so you know. And with that, I will pass it back to Dr. Goodrich.
Yes, thank you. So I'm going to tell you about 2 more of our specialty areas. So another area of focus you can do if you get an MPH is to specialize in environment, sustainability, and health. And, you know, it's maybe fairly self-explanatory what this is, but, you know, the course offerings in this area really try to bridge, you know, sustainability and environmental sustainability with how that applies to health. So, you know, thinking about how is climate change impacting, you know, water access and quality in the environment, and then how is that impacting health? You know, all of these kind of things fall under this domain. So some of the courses we have in this area include, you know, water quality management, air pollution, risk modeling. You know, there's a lot of really neat ways to model what the environmental impact of something will be using computational techniques. And then this, and you know, in this specialty, you can take a couple of classes in our School of Environment as well as in our School of Public Health here. And what's really neat is if you kind of Google career, if you look through, you know, job boards, environmental health sustainability manager is a new title that has been popping up all over the place. I know looked at this sometime last year, and there was over 4,000 job postings throughout the US for that job title, which of course this kind of degree prepares you for that directly. But, you know, now as, you know, companies and local governments and more, there's more awareness about the need to prepare for climate change and to make things more sustainable. I think there's finally, you know, this really important field is finally getting, you know, the attention that it deserves, and the market is opening up to, you know, for these types of jobs. So there's a big need here, and it's you know, very, very important for communities and for the world. So one other kind of degree that you can do with us and with epidemiology, we call occupational and environmental epidemiology. So for those of you who are more into, you say like, okay, I just want to work on human populations, I want to do a lot of data analysis and things like that, you can actually apply through our epidemiology department here, but take this degree where about half your classes would be with us and half would be in that department, and we're all in the same building in the same school. And occupational environmental epidemiology is really focused on the health of human populations, or, you know, workers for the case of occupational, but really using, you know, sophisticated study designs or, you know, publicly available data to try to correlate, you know, environmental factors with disease, so we can figure out what is causing, you know, neurodevelopmental problems in children, you know, what is leading to asthma in, you know, countries with a lot more sources of pollution and stuff like that, and pinpointing what some of these causes of disease might be, so that you can dig into those even further and try to prevent them with policy, or, study, the kind of the toxicological side of things and figure out why it's leading to disease. But epidemiology is really important to establish actual effects in human populations and show, yes, we have evidence that this exposure harms human populations. And that's definitely a piece of evidence that's always needed to influence environmental policy and public health practice and things like that. And for our last MPH option, I'll send it back to Tim.
Great, thanks, Jackie. Yeah, so we also have an MPH in Environmental Health Promotion and Policy. Since it's such a mouthful, we just say EHPP. And this degree program was actually in response to demand from students who are not just looking to learn about the science of environmental health, but that upon graduation wanted to go out into their careers and have impactful change directly through improvement of environmental health. And so this program, this curriculum, which is only about 5 years old now and still remains quite unique across our peer universities, in that it takes environmental health science as its basis, but then pulls in components of health policy as well as health behavior. So these three different fields are overlapping in a very purposeful interdisciplinary nature, so that students leave with this exact training. They have the scientific understanding and knowledge to then go out in an applied setting, but also understand the difficulties and challenges and opportunities for having impactful change, improvements in policy, and truly promoting improvements in environmental health. Okay, so those are some of the overview of our specializations within the MPH degree domain. Let's shift now and talk about some of those specialty options within the MS degree domain. So similar to the MPH, students can specialize in environmental health science, in industrial hygiene, in environment, sustainability, and health, all similar to the MPH degree programs. They can also specialize in toxicology. We have an MS in toxicology, and Penny's going to talk about this in a moment. But these degrees, again, in the MS program are research focused. There are didactic course requirements, but students spend a significant amount of time conducting their thesis project. And again, this takes about just under 2 years, about 20 months to complete. And with that, I'll pass it back over to Penny to tell you a little bit about that MS in toxicology.
Thanks, Tim. What is toxicology? And we do have a master's program in toxicology as well as a PhD program as well. Toxicology is mostly trying to figure out how the environmental exposures can affect human health in a nutshell. And we study how the biological mechanisms of these exposures and how to probably mitigate some of these adverse health outcomes. So we do research in starting from human cohorts, big populations, analyzing epidemiological data, look at these environmental exposure effects in human populations, and kind of try to understand some of the mechanisms that might be driving those health outcomes, and test those in animal models as well as cell culture models, so that we go from the human being to animals, as well as trying to test these mechanisms in a petri dish. So analyzing a hazard, if you're interested in big data analysis, there are projects that involve a lot of data analysis without doing much research work in the lab. But there are also health outcomes that are related to human work as well as animal models and cell culture. And studying the chemical, what is the route of exposure? What are the effects of those exposure, and maybe are there any ways to predict later life health outcomes from the exposures, and are there ways to reverse it back to what a normal would look like? And a majority of the toxicology work is assessing some of these mechanisms of action and mitigating some of those adverse health outcomes and limiting the damages that can be caused by environmental exposures. And in the corner, right corner, we have a picture of Dr. Goodrich in the lab that we share. And it looks very clean, neat, and tidy, which it always is. And I'll pass the baton back to Dr. Dvanj.
Great, thank you, Peony. All right, so you might be a candidate for this program if you are currently an undergraduate student with junior standing at one of the universities listed on this slide, which does include the University of Michigan. This is our accelerated master's degree program. It's a 3+1+1, but basically a combined degree program that allows you to complete your bachelor's degree from your current institution, as well as your master's degree in environmental health sciences from Michigan, all within a 5-year time period. Next slide. So how would you apply for that? We do have a priority deadline of December 1st with a final deadline of January 15th. There's information listed here in terms of the website. But if this is you, if you are a current student at one of these institutions that was listed and have interest, please reach out to us for questions or check out the website for additional information. All right, so we've talked quite a bit about our master's programs. Let's talk about the PhD just for a moment here. We do have 2 different programs, 2 doctoral programs, one in environmental health sciences, one in toxicology. In terms of a typical time frame, it's about 4 years total on average for completion, with a range of maybe 3 to 5 years. It's highly research focused. There is some coursework that's required, but students take a doctoral qualifying exam. They do a preliminary exam, which is basically proposing the dissertation research. They work with the research advisor as well as a full dissertation committee to identify that research, formally propose it, conduct the research, which generally takes multiple years in the program of simply conducting the research, writing that all up in a dissertation, formally presenting it, and graduating in the end with the approval of your committee. Next slide. Okay, so what else can you do if these options aren't enough? So in addition to completing any of these degrees, an MS, an MPH, or a PhD, we do have students that pursue dual degrees. So in addition to completing a degree in environmental health sciences, you may also, in a combined fashion at the same time, complete, for example, an MS in the School for Environment and Sustainability, or in one of the engineering programs, or in public policy. There are many, many options beyond what's listed on this slide. Perhaps not going all the way to a dual degree, but what else could you do in addition to your degree in environmental health science? We have graduate certificate programs. So maybe analogous to the way that there's a major and a minor at the undergraduate level, a graduate certificate you might view as a minor at the graduate level. So you can use some of your elective space in your degree program to complete a grad certificate in injury science, environmental justice, global health, risk science, climate change solutions. And again, there's so many more that are listed on this slide, but just so you know, that's an option. Speaking of global health, for students that are maybe writing their master's thesis or conducting their thesis research, or for MPH students that need to do their required internship, you can do this in an international setting, literally anywhere across the globe. We have an Office of Global Public Health within our school that is an immense source of funds to allow students to do this. Several $1,000s to basically knock down any barriers that might be present. Your round trip airfare, all of your vaccines, visas, in-country housing, local transportation, food, you name it. The funding is there to provide this opportunity. if you're interested in global environmental health. Next slide. Continuing along the lines of financial support. Everyone who applies and is admitted to one of our programs is automatically considered by our admissions committee for a merit-based scholarship or funding award. There are also training grants, external organizations that are great sources of fellowships and scholarships. You might work at Michigan, we call it a graduate student instructor, or otherwise known as a teaching assistant. I mentioned the internships and the many sources of funding available to support those. This is another important point with the bullet there that says temporary or hourly workers. Specific for students in the Master of Public Health program, while research is not a requirement of your degree program, you are absolutely welcomed and even encouraged to get involved in participating in a research project, contributing to a research project. It might be 10 hours a week, right? Part-time that fits flexible hours into your course schedule, where you can actually learn about, if you haven't had an opportunity yet, about the research process, but really importantly, contribute to it and also get paid for that hard work. And then, of course, down at the bottom, the more traditional route of student loans through the financial aid office. Next slide. Okay, a bit about the application process. What makes a good application? We do utilize a holistic admissions process. There's not one thing that's more important than the other, and we're looking at everything that's submitted as part of the application. Important things to know, and this is all on the website, some of the programs have prerequisite courses. For example, a biology course or a chemistry course. Check those out now and see where you stand in terms of meeting those. In terms of motivation, when you write your personal statements, let us know what's important to you. What are your passions? What's driving your pursuit in graduate studies? And also, it's an opportunity to let us know if you've been impacted adversely, right, by the pandemic, whether it was your formal training or perhaps plans that you had that you either postponed or canceled. Don't be afraid to let us know that. It's a very common occurrence, and it's helpful for us to know. Letters of recommendation. It's important to know we do not require a GRE. So if you're thinking of applying to Michigan, there's no requirement for the graduate record exam, so you can cross that one off your list. Next steps, come and meet us. This is actually an advertisement for an event coming up really soon. This is next Friday, October 21st. If you're relatively local and can make it, or even if you're a little bit further away and you're willing to travel, next Friday afternoon, we have an open house. You can come and meet more of us, see the campus, see the school itself, talk to some more of our current students. We will have additional virtual sessions that we'll offer. You'll be notified about those over email. Reach out to Rachel Yarbrough. She's our graduate program coordinator. She's the one moderating this session. You see her in the chat. She's a wealth of information about the programs, about the application process, whatever it might be. And then some important dates. For the MPH, our priority deadline is December 1st. Our final deadline is May 15th. For the MS, it's also a December 1st priority deadline with rolling admissions after that. And importantly, what does priority deadline mean? Those that submit their applications by December 1st are given top priority for the allocation of those merit-based funding awards. For our doctoral programs, there's also a December 1st final deadline. Next slide, please.
Tim, I see we have a hand up. Do you want to unmute yourself to ask your question?
Yeah, thank you very much for this wonderful opportunity. I'm actually interested in the MPH program, and I hold a BS in biochemistry and a master's in environmental management, all from top universities in Nigeria. So my question is, I don't know, is the TOEFL test required for international students, given the fact that I am from Nigeria and English is the official language in my country, Nigeria, and all of my studies I've been taught in English. Both my bachelor's and master's program was the language of instruction for it was English. So I don't know, is the TOEFL test also required if I'm to submit my application?
Yeah, great question. Thank you so much. And I'll let Rachel clarify in the chat, but generally speaking, the TOEFL is required for all international students, except in the case where your university, where you conducted your bachelor's degree program, was fully conducted in English as part of the educational process. There is a list within the University of Michigan that recognizes those. In the event that your university is not on the list, I would still reach out directly to Rachel and work through that process to determine whether in fact you do not need a TOEFL. And I hope that helps to answer your question. All right, so a few more remarks about once you have submitted your application, then what can you expect? You can expect to hear back from us with an admissions offer starting in January. For doctoral students that are applying to the program, you'll also hear from us in January with an invitation to join our doctoral day program, which allows you to meet and directly with faculty and learn more about research mentoring options. In terms of those funding awards, those would come a little bit later after you received your admission offer. So you might receive your admission offer in January. You likely won't hear about the funding awards until sometime in February or a little bit into the month of March. In the meantime, connect with us. We'll actually reach out to you to congratulate you on your admission with an offer to chat, whether it's in person or over Zoom, over the phone, whatever your preference. So you can count on that. Next slide, please. And then, yeah, there's lots of other opportunities to reach out, connect with our faculty, with our students. There's a Discord channel. Following along that time frame, we do have a formal decision day to accept your admission, which is April 15th of next year, next spring. And then once you accept your admission, we look forward to seeing you in August to start your program.